Let's kickstart with this particular development. Just like the prominence of Ebola in 2013, the coronavirus in 2020, the Africa Center for Disease Control and Prevention has officially declared that the ongoing Mpox outbreak is a public health emergency of continental security. According to a report from the organization, there have been about 38,465 cases of monkeypox and 1,456 deaths in Africa since January 2022. The Director General of the organization, Dr. Kaseya, says that this declaration will enable the mobilization of resources across affected countries, unlocking essential fundings, threatening security and ensuring communication of engagement, boosting surveillance among others through a health approach. Now, the federal government and state government are also taking measures to sensitize on personal hygiene for workers and ensure that they wear appropriate personal protective equipment and wash their hands after having had contact with patients or contaminated materials. Now, joining us via Zoom is the former Director of Disease Control, Lagos State Ministry of Health, Dr. Eniola Erinosho. Will be joining us anytime soon on the program, but the monkeypox is here, and the federal government and the state government are taking proactive measures so that we will not have a reoccurrence in Nigeria at this time. You recall that monkeypox virus came up sometimes in 1958 in Denmark. And we saw a resurgence of it in Nigeria about 1971. And so these are some of the challenges that we are seeing at this time. What proactive measures is the federal government, the state government are to put in place to forestall another outbreak, with what we saw in September, 22nd of September, that should be in 2017, when we saw a resurgence of monkeypox virus in Nigeria?
Well, of course, that's what we expect, the director, some of the questions that we expect him to, provide answers to. But we also spoke on the breakfast yesterday with a medical practitioner, a public health consultant, who also mentioned that to an extent this is, a bit higher than some of the former health emergencies that we had in place, that we also had isolation, procedures and other emergency measures put in place, like the Ebola, the COVID-19 measures. And, you also spoke to us about ways to identify it, because in this part of the world, we still have the issue of, isolation. We still have the issue of stigmatization. And so many persons, resort to self-treatment in the long run because they do not want to have to present to most symptoms. And, there are so many self-made doctors, homemade doctors.
Very interesting there. They will just come in,
who resort to, treating themselves in a way, just getting drugs because probably, they're purging and they want to, and they start getting drugs, antibiotics. Antibiotics is now even less effective because so many persons have, overused it. And so basic measures like, proper health, it also leads to the cholera outbreak that we had earlier. So good sanitation and other measures. You also raised issues about the environment, the way that it can be transmitted, while it can also be transmitted to, sexual activities. Well, some other persons raised the fact that probably a separate demographic group, like those within the LGBT community, are probably those who are spreading this. But, it was able to put out a disclaimer saying that this doesn't necessarily have to come from that group. And putting a stigma on that group is sort of, against the information that they're trying to spread. So these are some of the factors. Also, how African nations can also come together to combat some of these issues. It's also in the Democratic Republic of Congo. And you know that some of these countries share borders with Nigeria. And so rather looking at a holistic approach in addressing these issues.
Holistic approach indeed, and to ensure that the federal and state governments work together to contain such virus so that it will not enter Nigeria at this time. We saw what transpired in September 2017 when we had that Ebola virus. And we saw how the federal government and the state government tackled the issue of Ebola. And also, so these are issues that the state governments need to be very much proactive.
Well, this has also brought up the issue of, border control. While we also are trying our best to manage what happens at the borders, Well, on issues like insecurity and other factors, they've also, been attributed to how loose some of our borders are in that sense. And for this monkeypox, well, it's kind of too late. It has gotten into Nigeria. I think we recorded about 39 cases thereabouts in Nigeria. And so what Nigerians have to do is, to be educated, to educate themselves and not just wait for the government in most cases to have to educate them and all. This is something that could actually lead to loss of lives. And there are also concerns about, the vaccination, that there are actually no vaccines or not enough vaccines to actually treat these things. And while the World Health Organization is, probably going to give out funding, it may not be able to, cover for the whole population. So these are major issues. But then awareness is also key. While some persons may also, misinterpret some of these symptoms to be, chickenpox, measles, and others, we were able to, find out some of the possible symptoms, as always presenting in the, clinical manifestations of some of these, diseases. There's a fever, there's a rash, but the monkeypox rash especially is quite bigger than
let me quickly put you on a pause at this time. Let's quickly join former Director, Disease Control, Lagos State Ministry of Health, Dr. Eniola Erioshu. Many thanks for joining us on the program this morning. A very good morning to you.
Good morning.
Good morning. Can you quickly walk us through what should be put in place to ensure that a lot of Nigerians are safe concerning this issue of monkeypox virus in the country?
Well, thank you very much. We are all aware that we have a case of Mpox in the African continent right now that started from Democratic Republic of Congo. And we know that a total of 17,000 cases have been reported, and most of the cases are in the Democratic Republic of Congo. In fact, over 14,000 suspected cases have been reported. As regards Nigeria, the Nigerian Center for Control provided information yesterday to a press conference by the Director General of the Continental, where it stated that Nigeria has 39 cases as of yesterday. And out of these 39 cases, the states that were mostly affected are Bayelsa and Cross River with 5 cases each, Lagos and Ogun with 4 cases each. Then we have the other cases in other states, like about 2 cases from other part of the country. Then he did mention that these are spread to 33 states in the country. That's how far we have in the country now. And the NCDC chairman, DG, also stated clearly that we have a lot of response in place, specifically that alert has been raised at all our 5 international airports, also at the 10 seaports of that country, and the 51 land borders that we have in the country. So what they do there is to ensure that any inbound passenger coming from outside the country fills the health declaration form, that is the HDF. And what the form entails is a series of questions that will be asked from the inbound passengers about their exposure to the Mpox virus. Maybe they are coming from a country that is infected, that has infections, and for how many days. Indeed, NCDC plays the number of days listed is 90 days that you have to provide. If you have been to a country that is currently having an epidemic of the Mpox in the last 90 days. So there are some other questions under HDF that we asked. This is just to ensure that suspected cases are immediately quarantined, as it was done during the COVID virus pandemic, and also ensure that confirmed cases are isolated. As the NCDC also provided information that all the infectious disease centers in the country, in the 6 zones, have been activated. And I know the one we had in Lagos State, mainland hospital, Yaba, which is the infection disease center of Lagos State. So, and again, the NCDC mentioned that Nigeria is expecting consignment of vaccines against Mpox that will be taking delivery of about 12,000 pieces. So these are the information provided, and that's the Nigerian response as of now. Thank you.
All right. So when we also, consider factors like health consultants saying we do not have enough vaccines in place to address this, and some potential concerns like some doctors are likely to go on strike. Would you say Nigeria's health infrastructure is strong enough to combat a possible surge in these cases?
I personally have confidence in the Nigerian health sector. I believe we have the experience in managing emergency outbreaks, and we know exactly how to respond. So, and I know those that are those that are in charge now, that are on top of their case. And I believe we have enough personnel to ensure that we combat this Mpox. I know that we have public health experts, we have epidemiologists, and we have the experience of containing Ebola virus, and also we are Nigeria was commended for the active participation and response during the COVID-19 virus. So I don't have any fear at all that Nigeria will not be able to handle this. I believe Nigeria will handle it, and we are going to contain the Mpox within a very short period. I have that confidence. And again, don't forget that we have emergency operation centers at the national level and in all the states. And I'm sure these emergency centers have been activated based on the declaration by African CDC that declared Mpox as a public health emergency of continental security on Tuesday, August 13. This was followed by declaration by the WHO of the Mpox as a public health emergency of international concern on Wednesday, August 14. And the NCDC gave a press conference on Thursday, August 15. So, and I'm sure with all this declaration, all the emergency operations centers in the country will have been activated, and I'm sure they are ready to manage cases. And I believe strongly that our infection center in Lagos State, that is the mainland hospital, those in charge are already taking proactive action to ensure that we are able to quarantine suspects and also isolate and manage cases. So I think Nigeria is ready and capable to respond quickly to the Mpox.
Dr. Erisho, with Nigeria's experience in 2017 of this Mpox virus, what are those preventive measures that Nigerians should put in place to avoid this virus?
One thing that we have to state clearly and know is that emergency can occur at any point in time, and we should not forget that the Mpox virus is endemic in Africa, especially Central Africa and West Africa, including Nigeria. So we always expect that every now and then we're getting virus, but I know that actions are in place, strategies are in place, and we are the country, all the states, I believe they are fully ready and prepared to respond to this particular emergency. I know WHO maybe later will be able to talk about eradicating the virus, just as we have eradicated Mpox. But for now, what is important is preparedness and response. And I believe Nigeria is capable. And don't forget that we have laboratories in Nigeria that can make diagnosis of these highly infectious. For instance, I know that in Lagos State, we have our safety laboratory, and I believe cases in Lagos State and some neighboring states will be confirmed at this Lagos State Biosafety Laboratory. I know we have at the national level too, and we have in various states. So Nigeria is ready to detect the virus, to quarantine the suspects, and also to isolate and manage it so that we can prevent the spread of infection. And again, I did mention that the RCCE, Health and the Federal Ministry of Health, they have started action at our various ports to ensure that we get information from inbound passengers so that the virus is not imported to the country. And these are the actions that big government is taking, and we are getting better. Thank you.
All right. So can you, walk us through what the government's plan is as regards addressing stigmatization, to help speed up the process of, identifying some of these patients?
Please, can you go over that again?
I said, can you talk to us about what is intended by the government to address the situation of stigmatization while raising awareness on some of the symptoms, addressing stigmatization, okay, so as to, improve contact tracing?
Well, thank you very much. I know that, as I said earlier on, we have experience in responding to emergencies in the country. That is health emergency. And I know the first thing that the government has done is to ensure that we have a high quality surveillance that can detect cases immediately anybody is infected. So all the environmental officers, I believe, are in the field right now in no country, doing contact tracing, just to ensure that those that have remote contacts and immediate contacts of suspected and confirmed cases are also placed under quarantine, so that if anybody comes down with infection, they'll be able to know that they first have Mpox or suspected Mpox and attended to. That's one. Then again, I know the country and the states are already doing outbreak response, outbreak investigation. The first thing is to confirm the infection and confirm there's an outbreak, and also try to find out the source of infection. We usually talk about index cases, which is the first case that is causing infection in particular. And I believe RCCE must be on top of this to ensure that we identify the very source of this epidemic in the country. And I believe in a short period it will tell us. So another thing, part of the response again, is to ensure that we have prompt diagnosis. That any suspected case is diagnosed immediately through laboratory tests. And I did mention that we have specific laboratories for these high-risk emergencies, like the biosecurity laboratory in the state and in some other states and countries. So these are the things that are done. And again, I mentioned earlier on that all the isolation centers have been activated. These are the infectious disease hospitals in 6 geopolitical zones of the country. They have been activated, and I believe that the biggest mainland hospitals must have been activated by now. Then apart from that one, we also have the issue of vaccination, which is part of the response. And the NCDC DG did mention that the country is expecting 10,000 doses of vaccine. I know WHO stated clearly that for now, we have only 500,000 doses of the vaccine available worldwide. And it will be made available to African countries, and that Democratic Republic of Congo and Nigeria
Dr. Eriosho,
giving top priorities.
All right, it's a fine place to leave it at this time. Former Director, Disease Control, Lagos State Ministry of Health, Dr. Eniola Eriosho, thanks for joining us on the program this morning.